One group struggling to get their voice heard during the campaign is the aged care sector. Operators are calling for urgent deregulation and funding reform. They say government inaction for many years has left the sector in crisis, struggling to meet the demand for nursing home beds. Emma Pollard reports.
Allan Barker spent his working days as a banker, moving from town to town, building a modest life for himself, his wife and 2 daughters. He's a bright and humble man who survived the siege of Tobruk in northern Africa during World War II.
No VCs.
Until recently, he was enjoying retirement and the quiet life. And then, at 91 years of age, he made the difficult choice to go into a nursing home.
It was a very hard decision after all those years of having our own home and our possessions which we'd gathered over the years, you know, not thinking that you're thinking greatly of the possessions that you have, but all of a sudden when they're not going to be there or you've got to do something about it, it is quite a hard step.
Allan Barker opted for this new centre in Brisbane's northwest. He sold his home to pay the bond required, but he was still short. His children made up the difference.
There's a little bit of family assistance against some investments that we had. We were able to cover that situation.
He's happy and secure here. But Anton Kardash, who heads the peak body of aged care providers in Queensland, says he's worried not everyone will be as comfortable in their twilight years.
We see the challenges of the lack of places for the future, and it's time for us to stand up and be counted.
The bulk of aged care funding is provided by the Commonwealth Government, which regulates all aspects of the industry.
We're fearful that, in fact, if things don't change, that there will have to be closures.
According to government figures, the number of Australians over 85 will more than quadruple in the next 40 years. The industry says providers don't have the money to build the facilities needed, and without significant changes, the beds simply won't be there. The peak body says a change to the bond system could help make the difference. Bonds are deposits that residents pay to nursing homes when they move in. The nursing home invests the bond securely and deducts some fees. Then the bulk of the deposit is returned to the resident when they move out or to their estate. At the moment, only people who require low care have to pay a bond. Aged care groups also want high care residents to pay bonds.
The bonds in high care issue is an issue that no government wants to talk about. But in fact, as more and more people move into high care, we really need to resolve how we're going to fund the capital to build those beds in the future. And the proof is in the pudding. People are just not doing it at the moment, so it's not working as a system.
Michael O'Neill from the lobby group National Seniors Australia agrees funding reform is long overdue.
I think what we need to be looking for is more innovative models. So we've seen some suggestions of national insurance type programs, some extra percentage points taken out of perhaps a Medicare kind of approach, through to superannuation, part of that being put aside. I don't think there's any one model at the moment that will necessarily work. What it does require is a good hard look at a range of choices.
The industry says funding shortfalls are already having an impact. Aged care nurses are poorly paid in comparison to other nurses.
On average, it's about up to $300 per week less for a registered nurse who is working in aged care compared to their counterpart in the public or private hospital sector. Now, that's in effect about a mortgage payment, so people are just having to make decisions about where they work based on remuneration.
A Productivity Commission inquiry into aged care is currently consulting with industry and will deliver its final report early next year.
We recognise that it is a major challenge with our ageing population. That's why, since we've been into government, we've had these major reforms, increase the funding, increase the places, and it's why we've now engaged the Productivity Commission to have a very thorough look, a very comprehensive look at what's required in terms of our aged care sector for the coming decades.
The sector says the review could bring about real change, but believes it won't be soon enough. It's launched a campaign aimed at both sides of politics, hoping to capitalise on an election.
We don't have the power of the mining industry. We're not a sexy industry in some sense, but aged care has been overlooked despite what governments have said, for a good number of years now. It really has irritated me a little bit that, you hear the catchcalls of, working families. The people in aged care were those working Australians who made a difference.